Hi, my name is Michelle Wieber, and I'm here to talk about pelvic health today. It's not necessarily everybody's favorite topic, but I will be talking some about pelvic pain and incontinence, which is something that's a part of the human experience. And physical therapists do a great job treating this, and we do that here at Wieber Physical Therapy. Pelvic health is for both men and women. I would say 70% of the people that seek out care in this area are doing it. They are women. But I certainly have men that are coming to see me after a prostate surgery or even before to get started on pelvic rehab. Physical therapists work in the area of muscles as well as the nervous system, and of course we also treat joints. And so that's kind of the umbrella that pelvic rehab sits under. So I'll be talking to you today about muscles and the nervous system and some things that you can do for yourself at home. So when I think about what would be my top 3 recommendations that you could do if you're a man or a woman struggling with urinary incontinence, the first would be to really limit the amount of caffeine that you're taking in and be sure that you're getting 48 to 64 ounces of uncaffeinated fluid. So that would be milk or juice or water. Just be watching out for things that contain caffeine because that affects your nervous system. It makes your bladder more likely to want to contract and maybe potentially is feeding into the incontinence. The second thing I would say would be walk. If you can walk, you got to walk to keep your hip strength and keep your health up. Myriad of other reasons, but it does have an impact on staying dry. And the third thing would be to do pelvic muscle exercises. So importantly in that, a lot of the people that I see here at the clinic that are coming in with incontinence don't really know how to do that exercise. And so I'll be showing you later what we do with biofeedback or perineal biofeedback specifically to help people learn to use the right muscles. So pelvic muscle exercises sometimes are called Kegels, but you need a combination of both, ones that are quick and ones where you're actually trying to hold the contraction. And research shows with about 8 to 12 weeks of pelvic muscle exercise, people do get better. The other reason people come to see me for pelvic health is because of pelvic pain, whether that's related to something from a surgery that they had, or if it just happened after an infection, or it just occurred. So my top 3 recommendations that you can do for yourself at home regarding pelvic pain would be, first of all, get any kind of urinary tract infection checked out or any kind of pelvic infection ruled out by your physician, your medical provider. The second thing I'd want you to do would be to get aerobic exercise. We know that even 10 minutes of aerobic exercise at a low level of heart rate, meaning you can still talk and have a conversation. At 10 minutes, we start producing endorphins, which flow over our brain and are stronger than any opioid medicine. And this is your control center. So if your brain is happier, the pain from your pelvis is likely to be significantly less. So aerobic exercise at a minimum of 10 minutes. And the third thing would be to perhaps get online, look at YouTube, and consider practicing some relaxation techniques. Again, because you are having a pain problem, it's really common to tense and tighten when that isn't needed. So relaxation. So those are my top 3 for incontinence. Would be make sure you've got adequate fluid, make sure that you're walking, and make sure you're doing pelvic muscle exercises. And my top 3 for pelvic pain would be make sure you've ruled out anything that would be detrimental to your health by seeing your physician or medical provider. Secondly, get aerobic exercise, at least 10 minutes, even more is better. And then the third thing would be to really go after relaxation. Now, what would we do in physical therapy that would be different than what you would do at home? We do a full exam here. I treat pelvic muscles just like any other muscle in the body. They can be tested for strength, they can be tested for length, and they can be tested in that way for flexibility and for coordination. And one of the many ways that we do that that's kind of unique to physical therapy is that we use a biofeedback unit. Now a lot of these are actually being sold online. So if you get onto Amazon and typed in pelvic rehab or pelvic muscle exercise, you might see some over-the-counter versions of these. This is the medical grade version. And so I'm going to show you here. I'm currently have my pelvic muscles hooked up to my computer. And because I'm talking and using my arms, you can see that the rose is closed. And that tells you that my pelvic muscles are working and they're part of my core. But if I really concentrate right now and I relax and I think about opening the rose and relaxing my pelvic muscles, let's see if I can do it. Maybe not because I'm on the camera. Let's see. Okay, now that's a muscle that's relaxed. That's a muscle that'll have less pain. And now I'm going to contract the pelvic muscle. See that rose start to move a little bit? And I'm closing it, and now I'm relaxing. So this is something that we use in our training as physical therapists to help people know if they're contracting the right muscle. Here I go again. I've got a pretty hard setting. So let's try it the easier setting. Now I'm going to close the rose. See that close? I can hold it, and then I can relax. Pelvic muscle exercise using biofeedback units use external sensors. They look like this. They stick on the outside. They're not painful. This is more like having an EKG for your pelvis. You know, you get stickies on to measure your heart electrical activity, and that's what biofeedback in the perineum does as well. It measures electrical activity. So if you have questions about pelvic rehab, pelvic pain, pelvic incontinence, please give our office a call. We'd love to try and help you out.